Este es un espacio multilingüe.
This is a multilingual space.
Please speak slowly for interpreters. Por favor, hablen despacio para los intérpretes. Si está conectada a través de su computadora y quiere escuchar la interpretación del inglés al español, favor de hacer clic en el globo que aparece a mano derecha. Luego haz clic en español para escuchar la interpretación. Si está llamando desde su celular, haz clic en More o Más, luego Interpretation o Interpretación, luego Español y finalizado.
To hear interpretation from Spanish into English, please click on the globe on the bottom right. Then click on English to hear the interpretation. If you're calling from a cell phone, click on More, then Language Interpretation, then English, and done.
Thank you, everyone. Interpreting is now active. If you have any challenges accessing interpreting, you can message tech support, Jamila, that is me. And also for panelists who will be conveying this very important message, a reminder to make sure that you are speaking at a pace for both ASL and Spanish interpreters to be able to communicate your message. If you see me make this motion, it means to slow down a little bit. And if you see this, it means speak up a little bit because we can't hear you. All right. Have a wonderful, wonderful event.
Good evening, everyone. My name is D'Angelo Cameron. I'm the Senior Manager of Digital Engagement at Common Justice. Thank you for joining us for our webinar and Week of Action kickoff for the Fair Action to Victim Compensation campaign. Before I introduce our moderator for our webinar, I'd like to give a brief background on the campaign and the Week of Action. The Fair Access to Victim Compensation campaign is a statewide campaign led by several local New York-based groups and national organizations who are fighting for expanded and equitable access to victim compensation funds. Currently, in New York State, survivors of violence are subject to onerous law enforcement reporting requirements when filing for victim compensation funds, and barred from access if they allegedly contributed to the crime in question or failed to show physical injury associated with their harm. This denies resources to countless survivors that could be used to pay for medical bills, funeral expenses, replacement of personal property, and other costs associated with the harm they experienced. Our goal is to raise awareness about the Victim Compensation Program and propose several legislative bills to eliminate any barriers to access that survivors face. The first bill in the campaign removes the requirement that survivors report their harm to the police in order to be eligible for victim compensation by expanding the forms of evidence that could be used to show that a survivor suffered harm. We are calling on elected officials in New York State to support and pass the Fair Access to Victim Compensation Bill, S7573 Myrie, and A8619A Meeks to ensure that all survivors have access to healing. During the Week of Action, we're asking that folks participate by contacting their local legislators and sharing tweets and graphics we've developed in a social media toolkit that I will share in the chat below. I've now shared the toolkit in the chat. We also have a campaign page with more information, resources, and more ways that folks can get involved on this incredibly important campaign. I will also share that in the chat for everyone. We will have time for Q&A towards the end of today's session. We ask that you put any questions you may have in the chat, and we'll do our best to answer them. Today's conversation will be moderated by the amazing Josie Duffy Rice. Let me tell you a little bit about her before I pass it off. Josie Duffy Rice is a journalist and law school graduate whose work is primarily focused on prosecutors, prisons, and other criminal justice issues. Until May, she was president of The Appeal, a news publication that publishes original journalism about the criminal justice system. Josie co-hosts the podcast Justice in America and the podcast, What a Day. Her work has been featured in the New York Times, Vanity Fair, The New Yorker, The Atlantic, and Slate, among others. Thank you, and I will now pass it to you, Josie.
Thank you so much, D'Angelo. Can you guys hear me? Thank you so much. I am really absolutely thrilled to be here joining you all today. Thrilled to be part of this very important conversation. And as always, I'm so grateful for the work of Common Justice. So thank you so much for having me. I want to get started with some questions, but I wanted to first introduce our incredible panelists. So thank you so much, D'Angelo, for that great intro and for that information at the beginning. And I just want to do a quick introduction of everybody who is joining us, and then we will get started with some questions. So Jessica Mofield is a community engagement and social impact strategist with lived and executive experience in building community partnerships, racial equity, strategic investments, and storytelling. Ms. Mofield leads the New York City Office of Neighborhood Safety, which addresses the individual, familial, and community-based needs of historically disinvested and marginalized communities through aligning the city's public safety initiatives, trauma, people-centered informed strategies, and grant-making opportunities to foster mutuality and trust among nonprofits, community, and government. She is also a senior fellow for the Atlantic Fellows for Racial Equity. Senator Zellnor Myrie represents the 20th district, which includes several neighborhoods in central Brooklyn that have been at the epicenter of both the gun violence crisis as well as community-driven solutions to address it. Currently serving in his second term, he is the author of New York's groundbreaking gun industry liability law, the first state law in the country to hold manufacturers and dealers accountable for their irresponsible actions in the marketplace. Heather Warnken was named Executive Director of the Center for Criminal Justice Reform in January 2022. Prior to this, her work at both the U.S. Department of Justice and Berkeley's Warren Institute was focused on addressing the harm caused by the criminal legal system and promoting healing in marginalized communities. This work has included efforts to end the criminalization of trauma and to increase resources for community-based strategies and services. Gabriel Garcia serves as the Policy and Advocacy Director for Youth Alive, a community-based organization in Oakland, California, focused on, please go back upstairs. Thank you. I'm sorry, my 4-year-old loves to pop in at the most inconvenient times. Focused on violence prevention, intervention, and healing. In his time at Youth Alive, Gabriel's advocacy has helped to secure historic, local, and statewide investments to address violence by amplifying the voices and expertise of Youth Alive's staff, clients, and youth leaders. Currently, Gabriel is working to establish survivor-informed and healing-centered justice through reforms to California's victim compensation program. We also have Assemblymember Demond Meeks, who represents Assembly District 137 and is a native of Rochester, New York. As a servant leader in the Rochester community, he has been an advocate for quality education, fair wages, workers' rights, and social justice. As an administrative organizer with the SEIU, he represents nearly 800 healthcare sector employees and takes on an array of tasks, including bargaining contracts. He entered the political arena to improve the standard and quality of living for all Rochesterians. The first time I've ever heard that term, which I really like. Anthony Buissereth is a veteran of New York City's nonprofit sector with more than 17 years of experience in nonprofit management, fundraising, program development, advocacy, and government and community relations. In February, Anthony joined Kings Against Violence Initiative as co-executive director. KAVI centers public health and community wellness to prevent and eliminate interpersonal violence from the lives of young people. Prior to joining KAVI, Anthony was executive director of North Brooklyn Neighbors. So we have an incredible panel, an intimidating panel, I will be honest, but I want to get started with some questions so we can make sure that we have enough time to answer questions from the audience. Oh no, my light. So that's a reminder that if you have questions, please send them to the chat at any point now in the next, 40 minutes that we're talking. We would love to hear what you guys want to ask and want to make sure that we give the opportunity to the panelists to answer those questions. So Jessica, I'm going to start with you. Can you please tell us what victim compensation funds are and why they are so important to survivors of violence from Black and Brown communities?
Sure, and happy Monday all, and thanks for the question, Josie. So victim compensation funds are essentially the things that are provided to survivors of a crime to help them reestablish a sense of normalcy in their lives. So, as previously discussed in the opening of the webinar, they kind of highlighted, emergency burial funds, the need to have medical bills paid for, the ability to relocate, the ability to receive lost wages. So all of those things is supposed to help folks when they experience these really traumatic incidents, have a sense of calm, have a sense of support, and have a sense of stability in a time that feels very psychologically distressing in their lives. And that has the ability to domino and cascade into other areas, like their financial stability, their mental health, et cetera. So the idea of having victim compensation is to really recognize people as victims and then help them in their journey to healing so that they can move from a place of healing to actually thrive. But what we actually see is that for folks that are Black and Brown and in our more vulnerable communities, there's a determination that's placed on who's allowed to heal and who doesn't. And I think we're really trying to get to a point where we're allowing people to design their own healing as opposed to picking and choosing who's worthy based off of who's making these decisions about who gets recognized as survivors, who gets recognized as victims, as opposed to just being a perpetrator, which we know is a very fine line between Black and Brown boys in our communities.
Thank you so much, Jessica. That was really helpful. I want to follow up with you and ask, what are some of the barriers that you've seen when it comes to accessing these funds?
Yeah, I mean, the barriers really come in terms of how do people navigate systems, because a lot of the social services that are supposed to help communities actually it helps the cycle of harm continue when it's supposed to stop it. So, the biggest barrier that I've seen is relocation. I think it's very common for people to say, hurt people. But when they leave the hurt people in the same positions and the same spaces, and they wonder and ask the question why they're still hurting people, because they haven't had a space of reprieve to actually define what their new normal looks like for themselves. So if we're talking about racialized and compounded trauma and how we're actually able to heal towards that, sometimes systems make it even more difficult for people to navigate their way to a place of healing because of the stopgaps that they experience, particularly around housing. If you live in NYCHA, there's the ability to have portability requests. If you have a Section 8 voucher, you're kind of able to navigate through HPD. But what if you're, a person who doesn't have touch points with the system in that way and you're not receiving any subsidies? What do you do then? And I think a lot of what we've tried to do is really just provide healing grants for people to just kind of maneuver and to just have space to kind of determine what they need, as opposed to just allowing them, to just say, because you're not connected to any systems, we can't help you. Or, if there are undocumented people, and again, they're not connected to the traditional social service, structures that are set up to help people, what do we then do? And again, that begs the question of how do we even define victims and or survivors? Because if we're still allowing law enforcement to make the decision of who gets buried with dignity and who doesn't, who gets moved with dignity and who doesn't, it kind of changes, what the intent and purpose of this was to begin with, and that's to help families. So main barrier is relocation. Another issue that we find is also, burial funds. The way that the system is currently set up is that, you get $3,000 upfront, a maximum of 6, and then after the funeral services, you get the next iteration. But what we've seen is that funeral homes have actually denied services and or homegoing, kind of memorials to happen for families because they don't have the money up front. And they feel like because they haven't received it, we've been burned in the past, so we can't do this. And it's the most horrible thing in the world to be on a phone with a mother who has no clue how she's going to bury her son or daughter. No one should ever have to be placed in that position. And we also know that funeral homes also prey on the vulnerability of families. So what happens is, they're told that they need to have the money up front. And if there is a subsidy that we can provide, so if the funeral exceeds over $6,000, we can tap our partners at HRA to cover the balance. When we get the bill, it's much higher than what they gave the family. So it's just like, which is it? I get that this is a service and there's a business model, but you also have to do it with a sense of humanity and dignity for how you're navigating things. So, low-key extortion from funeral homes sometimes is another barrier that we face. And then also, we've even seen, families be denied access to their loved ones' belongings because of ongoing cases, but no communication with the family about where they are in the case in terms of advocacy, in terms of actually, having someone and, really explaining and having like a justice education process of what that actually looks like. People go to get their loved ones' belongings and it's just like, no, you can't have it. And it's just like, you're still speaking to a grieving mother, regardless of the narrative that you have created around their son or daughter. So being able to respect that is very important. Just because someone has touch points with the justice system still doesn't mean that they're a human being and that they still deserve the dignity of being respected. And that includes and extends also to their families. So again, can't stress this enough, really having Black and brown boys and girls and their families being recognized as victims so that their families can be seen as survivors is important, because without that recognition, we will continue to meet the same barriers and hurdles that prevent people from actually healing.
Thank you. Thank you so much for that. I really, giving me a lot to think about. Senator Myrie, why might survivors of gun violence or assault be reluctant to report what happened to them to the police? I think that seems to be a fundamental misunderstanding that people have about the role that victims' compensation can play, and I really want to make sure the audience understands why that would be.
Yeah, thank you for the question, Josie, and Jessica for, I think, really insightful answers. Good evening to everyone, and I will echo the happy Monday. Big shout out to Common Justice for all of the work organizing this and for really leading on this important campaign. With regards to the interactions with law enforcement, the unfortunate reality in our state and all across the country is that the population that is often victimized also has really traumatic experiences with law enforcement. They tend to be those who are marginalized by our law enforcement infrastructure. And so we're talking about people that look like me. We're talking about individuals from the LGBTQIA+ community. We're talking about many women who have been accused, harassed, assaulted, and in some instances killed by law enforcement, requiring them to go to that same institution that has inflicted so much trauma on them in order for them to get the services that they deserve is an obvious barrier. And I like to tell folks that, I have had the good fortune in life. I have a couple of postgraduate degrees. I'm an elected official. I've had some professional success. And even with all of that, when I went to go protest, I was pepper sprayed and handcuffed by the cops. So someone like me, who might have been the victim of another assault or another crime, is not going to feel comfortable going to the cops to help vindicate my story or for it to be a prerequisite for me to get the funds that I deserve. And so what's so imperative in this campaign and in this bill is for us to remove that barrier, that there are far too many people that are not engaging, that are not getting the services and the compensation that they deserve simply because they don't want to be re-traumatized, or they're afraid that they will be accused or that they will be dragged back into a system that they have made it out of. So there are a lot of, I think, rational reasons why people choose not to engage with law enforcement after being victimized.
Yeah, absolutely. A follow-up to that question, the type of services that are reimbursed by New York State's victim compensation program, mental health, burial costs, and temporary housing, just to name a few, as we talked about already tonight, are widely needed in Black and Brown communities and place survivors on a path towards healing. Do you see these as services that also prevent future violence from happening as well? And if so, how?
Yeah, so, and I think Jessica touched on this a little bit in regard to the services that are needed and why they are so important for victims of harm. But I want to take a slightly different tack. If we look at some of the services that are made available here in the state of New York, expenses for medical or other related services, lost earnings and savings, counseling services, the return of essential property, transportation expenses, attorney's fees. Think about if we weren't just responding after trauma and harm, but instead investing in all of those things up front, we would be reducing the collective harm that we experience. When you talk about healthcare, when you talk about the provision of jobs, when you talk about mental health as it relates to counseling, when you talk about transportation expenses, when you talk about giving people a right to a lawyer and right to counsel, these are all things that if we put the investment up front, we would be able to help those who experience harm and also those who perpetrate harm. We would be able to, I think, solve a lot of the problems that we're facing right now. And so giving victims the services in those different silos, of course, helps them, but it is also a very effective public safety tool. It is an effective way to reduce crime in other areas and really presents a blueprint for us to be investing up front so that we are not having this conversation about harm in the first place.
Absolutely, thank you. Heather, I want to turn to you. So I know you've done a lot of research and policy work surrounding victim compensation fund services and equity at the national level. Can you tell us what you have found regarding who experiences violent victimization and who has more access to victim compensation funds? And can you talk to us about why that is? Why do these disparities exist?
Definitely. Thank you for the question. And I feel like those are such big questions, and we may just get to scratch the surface in the limited time we have today. But I'll dive in by sharing some findings from a report I co-authored in 2019, utilizing DOJ's own data, which presents a number of relevant findings. Overall, that people of color are more likely to be victims of serious violence, particularly when race and ethnicity are considered in the context of socioeconomics and place. So this report utilizes NCVS data, or the National Crime Victimization Survey. And for as imperfect as that source of information is, and we could go on about those key reasons, I will say it's also an important source of data in that it does not rely on law enforcement statistics, which is so important to look at victimization experiences that are not reported, which we know is a huge percentage of serious violence, upwards of 42%. So the report notes that Black people's risks for serious violence have remained 1.5 to 2 times greater than whites, Hispanic individuals 1.2 to 1.5 times greater. And often the Bureau of Justice Statistics does not produce findings annually on certain populations where the estimates are smaller and therefore seen as less reliable, which is also problematic. And by combining multiple years of the data, you're able to quell those concerns and publish findings. For example, in our report, that non-Hispanic American Indians who report rates of serious violence per the survey data at 2.4 times greater than whites. And another, I think, staggering finding that people who self-report as having multiple race backgrounds experience serious violence at a rate 310% greater than white individuals. And again, these data, based on a household survey conducted by the US Census Bureau, do not even include the experiences of many of our most vulnerable victims throughout the country, those who are homeless, transient, in and out of the justice system. So in some senses, it's really just the tip of the iceberg. The report also notes that 9.6% of victims of serious violence overall report access to services. 9.6%, notwithstanding all the laws and policies and protections we theoretically have in place. And notwithstanding these higher rates of victimization, numerous sources indicate that people of color and Black victims in particular apply less frequently and face greater barriers to access than their white counterparts. The Department of Justice releases annual reports based on the data that states are required to submit to DOJ. And so we know from that data that states approved 76% of applications and denied 24%. But these data do not break down those approvals and denials by race and ethnicity. And actually, some of the best public-facing information we have on this have not been a product of those official reports, but rather media investigations that have taken on looking into these disparity issues. And I'll give one example from Oklahoma. The program confirmed that 41% of Black homicide applicants were denied for benefits of surviving loved ones, compared to 27% of whites. And in large part because they were deemed as displaying contributory conduct. For Black sexual assault survivors, 100% of applications were denied, where a final decision had been made, compared to 54% for whites. And again, as we've already heard and will continue to hear throughout this evening's event, many of these reasons fall within this theme of this white supremacist society's limited and racially biased conceptions of who can be seen and served as a survivor, and in particularly a quote unquote deserving or innocent victim. And this is manifested well beyond compensation in the victim services infrastructure that is too frequently not been inclusive of all who experience harm. And I'll just use my remaining time to speak on a couple of more issues and themes of this throughout the country, which is that notwithstanding a lot of the legislative strides that have been made in a number of states, including the addition of good cause waivers or extended deadlines, in many places, one of the most problematic aspects is this ongoing reliance on reporting to law enforcement and the crime report document itself. And I want to add to the conversation that beyond the bias, a lot of times there's also just problems with inaccuracy. These documents are often written for different purposes. Information may be incomplete or misleading, such as inaccurately suggesting that a victim was uncooperative, for example, for not supplying information while they were incapacitated with a gun violence injury in the hospital. So denials based on involvement, contributory conduct, and in some states, a small holdout amount of states, blanket exclusions or felony lookbacks. So for example, an analysis in Florida noted that Black victims represented 30% of applications, but 61% of denials due to past felonies, even when the conviction had no relation to their victimization. And I think we're going to continue to hear a lot through the discussion tonight about these issues. But another piece I want to shed some light on is the lack of transparency or meaningful data around this issue. So, we're talking a lot about contributory conduct and bias around reporting and cooperation. I think people would probably be surprised to know how low those percentages show up in the national statistics that are reported. And I think part of what we need to take away from that is things like administrative denials, these other categories that programs use that kind of bury the picture of what's really going on and are really important for understanding how survivors are treated or how they navigate this system. And just a couple more points in closing before I hand it off, that I think the data issue also points to, for example, something that gets lost. Many states have their compensation program structured in 2 phases, an initial eligibility determination, and then after that, an arduous paperwork requirement where then you're supporting documentation. And, for example, that Oklahoma analysis showed that nearly 2/3 of sexual assault victims were denied, most because the applicant could not or did not submit a bill to reimburse any compensable expense and could not pay for the services up front. So the reimbursement structure in most states, that these barriers harm the most socioeconomically disadvantaged applicants, the same ones who need these programs the most. And then lastly, I just want to point to kind of a bigger issue that I think we all should be grappling with, which is that 31 states reported to the Department of Justice that changes to laws, initiatives, or policies had affected their compensation programs. And so there's a lot of activity throughout the country on this issue, including in state legislatures. But in so many places, we have seen that go on a collision course with criminal justice reform, that even in state that these necessary efforts to address fines and fees have decreased the revenues of programs that then they pay survivors out of, putting these really important issues in tension. And many programs, even who support the legislative efforts, are saying, we want those policy changes, but we don't know how to pay for it. And this financial solvency issue continues to come up. So I just want to end by saying we need to keep doing the work here and now and make this process more accessible and less re-traumatizing to survivors. We also need to play the long game and look at the deep structural reforms, including how these programs are paid for, that need to be addressed in the long run. Thanks.
Thank you so much, Heather. That was a ton of great information. I am really interested in the way to locate out of fines and fees and more light on that, in addition to what we heard earlier. Gabriel, I want to turn to you. So can you tell us a little bit about the work that you do at Youth Alive and how your organization and organizations like yours help keep our community?
Yes, of course. And just taking a second to process all of that information that Heather just shared. So for Youth Alive, we are a violence prevention, intervention, and healing organization based in Oakland, California. So the way that our programs are structured are really taking a look at violence as a public health crisis and addressing it with that public health approach. So being trauma informed and healing centered are foundational to the work that we do. So if I break it down into those 3 buckets, when we talk about healing from violence, right, everybody here has highlighted the necessity of making sure that we can reach out to victims of violence, survivors of violence, and provide them with the healing resources that they need in order to overcome the trauma that has happened to them. So our healing programs are based around that principle. We have a homicide response program where our crisis responders reach out to almost every single family in Oakland that experiences a homicide, that loses a loved one to gun violence, and One, we connect them to victim compensation and help them navigate through that process, but we really reach out and navigate them through the aftermath of losing a loved one, everything from funeral planning to connecting them to mental health resources and even helping them relocate if they no longer feel safe in their homes because of the loss that they experience. We also have and are fortunate enough to have an in-house mental health counseling team where we are able to build off of the effectiveness of proven mental health interventions, but also have a really innovative approach in terms of being able to meet victims and survivors where they are at. So instead of focusing solely on a clinical approach, we have our therapists actually go out into the community, meeting with survivors and clients, whether it's something as simple as taking them to a coffee shop or buying them books for school to get them on track and help minimize how disruptive violence can be in the lives of our community members. When it comes to our intervention work, we have some really great programs. One is Caught in the Crossfire, which is our hospital-based violence intervention program. And we have a team of intervention specialists who go to the hospital bedside of community members who have been violently injured, whether that is a physical assault, stab wound, or gunshot wound. Our intervention specialists go to their hospital bedside and address them and their families, because we know that for folks in that situation, those are critical moments where a lot of the natural instincts that people have actually put them at more risk for violence. These are things like picking up a gun, seeking retaliation, or joining a gang for protection. All of those things that do feel really natural to folks in the moment statistically put them at more risk. But when we're able to get an intervention specialist at the hospital bedside, that puts them on a path towards healing and away from retaliation, away from these natural instincts. We see that even though about 40% of violently injured patients end up getting re-injured within 5 years, when we have a hospital-based violence intervention program, that number just drops to 2%. So we're able to see how effective these programs are in real time. And part of my job as Policy and Advocacy Director is bringing that to elected officials who would otherwise not know about it, because these are smaller programs and are really most effective in places like Oakland, California, where we do have high rates of violence, right? Similar to what we're talking about in New York. But because we're able to come in and provide these services, it's really up to us to do the education on them. So we have several more programs that I could talk about. I do want to just make sure I can get our prevention programs in there as well. We actually have a high school violence prevention program where we teach high school students about violence prevention curriculum, and then they go to middle schools throughout Oakland and teach middle school students that same curriculum. So we get to do an intergenerational leadership development that is all focused on making sure that the young folks in our community have education and understanding about the violence around them, because it's not something that often gets talked about at the kitchen table. But when they hear it from not only their peers, but students that they look up to that are just a little bit older than them, that are able to provide mentorship in addition to that education, we see that not only does that have an effect on those middle school students, but the graduation rates for high school students within the program are much higher than they are across the rest of the campuses where our programs take place. So for us, if there is a way that people are impacted by violence in Oakland, we do have a program that in some way, shape, or form is able to reach out to them and again, address violence, not through a criminal justice lens, but through a public health approach that really focuses on healing and providing resilience for those that are impacted by violence and in neighborhoods that are heavily impacted by violence.
Thank you so much. The work that you all are doing is just absolutely incredible. That goes for everybody on this call. I feel very inspired and didn't know about a lot of this. So thank you so much for your work. So Assemblymember Meeks, I'm going to turn to you. Let me make sure I can see you. Okay, I can see you now.
I'm here.
Hi.
Hello.
Many people, including survivors of violence, just don't know about victim compensation funds, right? They just don't know that they exist. How can we kind of increase public awareness about these funds to make sure that the people who need the most know even, that they are out there?
Yeah, I think, I mean, for one is like groups like this, like everyone on this call, utilizing our social media platforms for one, but I think it has to become part of the system in which, upon going to interacting, whether it's at your doctor appointment, a community counselor, different community groups, just having forums and having information similar to like when you go to an employer and they have a posting up in a lunch break telling you the rules as it relates to the Department of Labor. We should push and have resources to have those type of posters and flyers and make sure that we're educating people on the resources that exist. And then also in the instances where people do come in contact with a officer of the law and reporting an incident, they should be required to share that information with them. And nowadays, I mean, with the technology, it doesn't always call for us to print something. It could be something as simple as a QR code that they could scan with their phones and get that information and be able to take the next steps.
Thank you so much. I want to ask you a follow-up question.
Yes.
I'd love to hear from you why it's critical, right, that all survivors of violence, particularly those from communities of color, particularly those that don't have resources that others might have access to these compensation funds. Just to kind of summarize overall for listeners why, you know, why these are critical for everybody and not just, you know, the people with the most resources.
Because it's part of the healing process. You know, when a person goes through a traumatic moment, one of the things that they're seeking is to be made whole one way or the other. And it shouldn't just be something that's beneficial to one group versus others. I mean, looking at some of the statistics as far as those who are compensated or utilize these resources the most, is a group that may not be victimized the most. So this is about racial justice as well as economic justice. You know, I just think back to some of the experiences, and, you know, Senator Myrie touched on the question you asked about law enforcement and, you know, people, the concerns that one may have. And I remember having a family member who was a shooting victim, and, you know, they were basically threatened by law enforcement. Until you tell us who did this to you, we're not going to allow the ambulance to go and take you to the hospital. You know, so those type of things are really disturbing. And I just think that we have to do what's in the best interest of all New Yorkers, not just a select few. And as it relates to nationally, we have to do what's in the best interest of all and not just a select few. So that's, you know, one of the reasons that I stand in support of this legislation. And I truly believe that we'll get it done.
Thank you so much. I want to go to you, Anthony. Sorry, my sound is doing something strange.
We can hear you.
Okay.
We hear you well.
It's going earphones, speakers, everything. I'm surround sound my own self right now. So
all good.
Anthony, I want to come to you to talk a little bit about KAVI's work. So KAVI takes a public health approach to ending violence. Can you tell us more about what that actually looks like in practice on the ground?
Well, first, thanks again for inviting us, and glad to contribute to the panel. So when we talk about taking a public health approach, we mean that in addition to supporting young people who are impacted by intentional injury physically heal, we seek to engage the broader ecosystem that causes intentional injury and look to promote community wellness. So that means over the course of a year, after someone comes to the hospital with an injury, we work to connect survivors and their families to an array of interventions that help. We connect them to mental health services, housing supports, counseling and mediation, school supports, workforce development and jobs, essentially whatever they need to be restored, heal emotionally, and have access to opportunities to help them thrive. But our interventions are not just limited to working with young people who come into the hospital with an injury. We work directly in schools and in community to prevent interpersonal violence in the first place. That includes working in schools to help students resolve conflict, hosting healing circles that address harm, and promoting dialogue and resilience in neighborhoods. Our approach connects to the broader issues that contribute to interpersonal violence because we believe they're critical components to addressing violence and building community wellness.
Thank you so much, Anthony. And from your work in the community, Do
Yep.
you feel like enough survivors are able to access, these compensation funds, and what type of impact would you see in your work, and what would it have in Black and Brown communities if these funds were more accessible?
So give a short answer for your question. The answer is no.
I'm not surprised.
Too many survivors are locked out of access, and that lack of access further contributes to their trauma. And I'll say that the young people we serve are from Black and Brown neighborhoods and are generally from the most economically disadvantaged households. And as Heather alluded to earlier, the inability to access these funds compounds their trauma and further limits their family's chances of having economic stability going forward.
Thank you. Thank you so much. So we have gotten everybody to speak. I have some more questions for our panel, but I want to remind people to please send in questions using the Q&A function. We've gotten a couple. I want to make sure that everyone gets to ask the questions they may have, and we've learned so much today, so please send them in. I wanted to, sorry, I'm looking at the questions that I wrote down and that I got from other people. So Heather, I want to go back to you just for a second, because you mentioned that victim compensation funds can often come from fines and fees, and that, there's this kind of cycle where we're taking, if we refuse to take money from poor people here, we refuse to give it to poor people in the back end, or people who are struggling, or people who need it. And you mentioned that we should look towards other ways of funding victim compensation. So can you talk a little bit more about how they should be funded, and what are the better structures than the one that we're seeing right now?
Sure. One thing I'll say at the outset is that currently right now, there's just so much variance across the country on how these programs are funded. So, it gets really messy in the details, but I think, overall, you'll hear these phrases that sort of like a boasting about victim compensation, that it does not rely on taxpayer dollars, that it's, victims are being supported on the fines and fees and assessments on those who, commit harm. And we know that both from, the reality of these issues and experiences, it is just so much more complicated than that. But like you said, it pits these things in tension. And so, I think there are a lot of ways that potentially it could be paid for that does not have such a problematic reliance. But I think overall, it's so much more expensive, to refuse and to criminalize trauma, that in these practices, even from an economic perspective, beyond the inhumanity and the pain that this causes, it is just actually more expensive not to help people, heal and recover. And so I think investing in a different way that doesn't rely on the criminal justice system in these programs, ultimately pays dividends in survivor well-being and the health and safety of communities.
Right. In many ways, this goes back to what you said earlier about the long game, right? When we are thinking about long-term strategy about how to build healthy neighborhoods and supportive communities, it's also economical. Jessica, a few panelists mentioned contributory conduct as a barrier to receiving victim compensation funds, and you were kind of touching on that earlier. Can you talk a little bit more about what they mean when they say what we mean when we say contributory conduct, and how it works as a barrier? Is Jessica still there? I can't see. Okay, I'm gonna move to the next, and maybe she'll come back, because I think I just saw her cut off. Assemblymember Meeks, do you think that removing the mandatory law enforcement reporting requirement would make our communities less safe because crime is not being reported to the cops? So this is one of the things we hear about removing that requirement. What do you say to people who say that it would make our communities less safe?
No, I don't think it would make communities any less safe. I actually think it would make it safer, because people would actually feel free to actually explain that they are a victim to someone, opposed to holding the trauma in. So whether they're talking to a doctor, a counselor, someone in their faith-based community, I think that it's helpful for a person to have an outlet to talk, but not necessarily an officer of the law. So I don't think it would make communities less unsafe. I think it would actually make communities better, because a person is no longer holding in the trauma, but having a venue, an outlet to express how they feel with a situation and what they've been through.
Thank you so much for that. I think that's absolutely right. I want to, I'm sorry, we're getting a lot of questions now. Great. So let's see. This is a question from someone in the audience who asked, who says that they work with families who have lost loved ones to gun violence, and asked why it's necessary for a final investigation to take place before a final payment of burial funding. I don't know if anybody has the answer to that specifically, but maybe Carolyn, you could connect to people in the audience, or sorry, people on the panel, if you want to know more about that specifically. So the other question we've gotten in a couple of different forms now is whether intervention programs are impacted by the unavailability of these resources, and if so, what does that look like? I don't know if Gabriel, you want to answer that question, or if anybody wants to talk to how the lack of these resources impacts other programs, again, that we were talking about earlier, that would help stop violence.
I can speak to that just from our perspective. So we're working to address this in California with a bill, Senate Bill 299, to remove some of these barriers specifically for victims and survivors who've lost a loved one to gun violence. And for us, it's all about the notion that when we get an older is denied for these services, oftentimes Youth Alive, we will come out of our own budget to support, whether that is putting money towards funeral and burial, or making sure that we can just be a stopgap for these folks. So when you look at the restrictions for victim compensation program, oftentimes there is a need for community-based organizations, nonprofits that are doing this work to use their own funding to supplement. Because when we do get denied, or when clients do get denied for these really essential services, that we know how re-traumatizing that could be, but we also, as a violence prevention focused organization, want to make sure that we're able to step in and create healing, because the data and evidence shows that the strongest predictor for an instance of violence is a previous instance of violence. So when we are working with those clients, again, being able to be that stopgap and use our own funding to support where these programs fall short is one way that we are impacted by these really strict criteria for deciding who is a deserving victim.
Thank you so much for that. And Heather, I think you wanted to jump in.
Oh, yeah, thank you. I wanted to go back to the law enforcement requirement piece and just share, a couple of important updates on this. I think some of the folks on the panel who are doing this work are familiar with this, but I want to make sure our audience is as well, that a pretty significant piece of federal legislation, the VOCA Fix Act, passed this past July, which clarified that states actually have really wide latitude and discretion about how they interpret this. And it really didn't change anything. It just made crystal clear that no states could say, oh, the feds make us do that, like the rely on law enforcement reporting. And so that's huge. And then DOJ issued some subsequent guidance, like again, kind of underscoring this to help encourage states to create greater flexibility and alternatives here. This is really good news and really important, and I think stimulated a lot of really good momentum at the state level. But I wanted to kind of draw attention to an important point that I think people should think about, which is that in places where some of those exceptions had already been carved out, like an alternative to law enforcement reporting or crime report documentation, One, that it was kind of more of that tinkering around the edges, for certain crime types or certain types of victims. And that's really a tough ground to be on, because it can have this unintended consequence of perpetuating that kind of deserving, undeserving victim, who gets an exception and who doesn't, back to that tension with needing to go more of a sweeping overhaul. But the other thing I want to point out about this that I think is important to watch is some of the states that have had some of those exceptions have had a disconnect between policy and practice. Like, are the programs actually letting applicants use them? It might say on the books for, child sexual abuse, or, a specific, there's a carve out where you don't need to report. And yet when you look at the, if you look at the data, are those exceptions being utilized? And this goes back to the point I made earlier about, I think, the need in this work to really push for more transparency around data collection and sharing at the state and at the federal level, and also better analysis of all the measures they're currently collecting and the additional data collection to spotlight things like this.
Thank you so much, Heather. Jessica, a few panelists mentioned contributory conduct as a barrier for accessing these funds. Could you just talk a little bit more about what contributory conduct means in this context, and how it works as a barrier?
Sure. So I think the simplest way to explain that is it kind of goes back to the concept of it being a fine line between victim and perpetrator. Mm-hmm. So if the language is a bit egregious, but they're like, if a person is affiliated with a gang or a crew, or right, if they are, if drugs are found on their person, or the situation was drug related, that would be, considered a reason as to why someone wouldn't receive the remainder $3,000 for emergency burial funds. And I feel like there's 6 degrees of separation for everyone. So to have it be loosely defined as like gang or crew affiliated, that could be anybody, in a 6 to 10 block radius. When I think about where I sit and the work that I do, and also know that I go back to, a family that has individuals like my father, my uncles, my cousins, whatever, that could be in that category, it makes it very difficult, again, to honor the humanity of the person as opposed to what they're in close proximity to. So I think the longer that we allow, other law enforcement entities, who has a very specific and kind of narrow focus on who this person is and how they showed up in community and how they're connected to all of these other people. Really looking at, again, if we, just to take a step back, if we did like a network analysis, we can probably see that there's connections to each other on this call. So if we're thinking about it in that way, and we're allowing law enforcement to make that decision, we run the risk of always being denied. There's very few incidences where, it kind of touches their heartstrings and it's just like, no, even though, they may have been exposed in this, or contributed to this kind of environment, which could really be survival, you know what I'm saying? And how do you navigate certain behavioral norms around violence, where they can kind of pardon that and acknowledge them in basically saying like, yes, they were a victim in this incident. So they're good, their family can receive that. And I have heard that, from community affairs officers that kind of, oopsie daisy, sorry, community affairs officers that kind of understand the dynamics of how our young people are kind of navigating the terrain of their neighborhoods, where, a lot of times the connectivity that people have in a particular network, there's so many things that come out of that. It's power, connection, stability, for better or for worse, but that doesn't mean that they're any less worthy of receiving, or their families receiving, because of the situation that they're in. No one is kind of considering like the traumatic retentions that we hold in our bodies and how that plays into how we interact with each other. So I think that would be the way that I would explain one of the barriers, and one of the huge barriers to why a lot of people have issues burying their loved ones. Also police involved shootings. That just came to mind. I'm sorry, Josie. I know you're trying to
No,
move on,
please.
but
This is great.
yeah, police involved shootings. There was one family that we were working with in Staten Island quite some time ago, and they couldn't bury him for like 2 months or have access to his body for 2 months because it was a police involved shooting. So anything, that, again, that gives any header or any sense of this person can be classified as a perpetrator in some way, their humanity is completely negated,
Right.
and their family is stuck with having to figure out, oh my God, how do I get them out of the morgue? And if we have a service, what do they even look like at that point?
Right.
So having to understand that the person that you lost you can't even get closure because they don't look the same way you left them. So I think understanding the nuances of that is really, really difficult. And it's offensive and
Devastating in 2 months.
Yeah.
Unimaginable. Thank you so much, Jessica. I want to ask you a quick question, Senator Myrie. So you've been a really vocal advocate for decreasing gun violence in our communities, in your community. And I'd love to hear from you why this issue matters to you so much, and whether or not you think we're doing all that we can to curb gun violence, especially in your state, the state of New York.
Yeah, I'm happy to answer that question. I did see Anthony with his hand up.
Oh, I'm sorry, I have missed
the
it. I
last
can't
question.
see everybody at once.
No,
Yeah,
it's okay.
Anthony.
So I want to give him a chance to.
Oh, he's not here. Did I lose him? Oh, there he is. Okay, hi, Anthony. Oh, I can't hear you.
Actually, I was responding to the previous question of
Great.
'cause,
Please jump in, and then we'll move on. But I want to
think
hear
Calvin
what you have
asked
to
the
say.
question about the impact on the interventionists, and I just wanted to add that like the work to deal with someone who's come to the hospital with an injury is like traumatic and it's hard work, right? So when folks go in, the frontline workers going in there to do that work, and they're like trying to help somebody get to heal in a way, right? They need these kind of morale boosters of like victim compensation, because it not only like shows that their work has value, but it also like re-energizes them, because the toll from the traumas that they experience working with survivors is really dramatic, and it leads to a lot of burnout. And for us, it's a critical piece to our work. So yes, it has a very, I would say we need this kind of a morale booster for our staff.
Yeah, thank you so much for that. I think emphasizing just mental, physical, and emotional toll that this work takes is really crucial. So I really appreciate you saying that.
Thank you, Senator.
Yes, and I'm sorry, I'm trying, there are many windows, small computer, trying to see everything at once. Senator Myrie, so you, as I said, you've been a real champion for decreasing gun violence, and I think we'd love to hear from you about why this issue matters to you so much, and whether or not you think we're doing all we can. Or I live in Georgia now, but you all are doing all you can in New York. I can tell you we're not doing all we can in Georgia. You all are doing all you can in New York to curb gun violence.
Yeah, no, thank you for that, Josie. And I'd say there's always more to do. I don't think we can ever do enough. I often say in the community and in different forums that we can eradicate gun violence in our generation. And people look at me and their eyes widen and they say, how could you say something so impossible? And I say, well, no one has that reaction when we say we want to eradicate cancer, when we talk about moonshots and going into space and doing all sorts of other, what I believe to be reaches. No one has that same reaction. People say, well, we can do it. But when it comes to gun violence, we say this problem is intractable, that there's no way that we're going to be able to stem this completely. We'll always live with it. And I fully disagree with that. We should not have to live with gun violence. We should not accept it. And we should not accept it in our communities because it's not accepted in other communities. I'm a Brooklyn boy through and through. I get the honor of representing the place that I grew up. And I've always had to deal with gun violence, whether it was being in the proximity or now as a representative having to talk to grieving families, going to the scenes of shootings, talking to the guys on the block, talking about why the violence happens. So this was always a very local issue to me. I think, and I appreciate that there is, I think, a larger conversation happening across the state about gun violence and how complex it is. But we worked in the legislature, and shout out to my colleague in the assembly, who, by the way, his tie is incredible tonight. I don't think we have taken a moment to appreciate Assemblymember Meeks's get up. So shout out to you, Demond, on the fashion. But last year we passed the Community Violence Intervention Act, which declared gun violence a public health crisis. That is in our laws, that is in our statutes now, that had not happened in the past. And then, of course, we passed a gun manufacturer liability law, first in the nation, to really go after the product itself. A lot of times we ask, well, why is gun violence continuing to happen, even though we have a very strong law enforcement response, even though we put money into community solutions? And that is because there is unfettered access from other states that have very weak gun laws. And in the face of inaction from Congress, we will never be able to stem that unless we really, I think, step up statutorily. So we were able to do that with a lot of folks on this phone call that helped to make that happen. So I think that's one solution, going after irresponsible, bad actors in the gun industry that put profits over people. Those guns that are used to perpetrate harm and trauma on our people, at least in the state of New York, 74% of them come from out of state. So we need to continue to be, I think, sharp in reducing that. But we also just need to be focused on the root causes of it. It's not breaking news to anyone on this call. It's time for us politically to put our money where our mouths are. We got a lot of tough talk from various political actors about public safety, about what it means to go after gun violence. And I think inherent in those narratives is that the very victims don't care about ending violence either. The way that they talk about gun violence and how that is looped into this narrative that anyone that cares about reforms to our criminal justice system doesn't care about victims, inherent in that is that we ourselves are not victims and that we cannot be victims. And that humanity piece that Jessica was referencing is something that I think we need to transfer into our political approach. And it's something that I'm excited to do starting with this bill.
Thank you so much. So I want to, since we're on the topic of legislation, I want to ask the Assemblyman if you can tell us a little bit more about the Fair Access to Victim Compensation Bill. We've gotten a lot of questions about it, and I'd love to hear from anybody on the panel about it in more detail. It's very clear people want to know even more.
I'm sorry, can you repeat the last part?
It's just very clear people want to hear more. So, just sharing more about the bill.
Yeah, I mean, for me, I really recognize this as, a racial justice legislation. When we look at, numbers and, those who are reaping the benefit of this this type of these type of resources are more often than not white women, 55 and older, making $75K plus a year, and more often than not, it's Black males, 35 and under that are the victims of crimes, and making $25,000 a year, if that much. So I recognize this as a racial justice legislation, and in doing this work, that's definitely something that I committed to, is like looking at things through a racial justice lens. I think a victim is a victim, right? A victim of a crime, and should be treated as such. Someone posed a question. Well, Jessica responded to the question about, if you were one who was involved or some way involved in a crime. And it made me wonder too, because I've seen instances, and we just, where you may have had a person who was assaulted, physically, and attempted to protect themselves physically, and someone decides to pull a gun out and shoot them. So in that instance, it made me start wondering, like, well, would this person be considered part of an act because they protected themselves with their hands, and another person decided to use a gun? And then, you know, being from Rochester, New York, I mean, we've seen our share of challenges, and we've had our share of victims this past year with over, we had 81 homicides, and that's not including the 300 other individuals who were victims of gun violence. So those were actual individuals who were shot. But then when you look at those who are bystanders, those family members, there's some serious levels of trauma. And, you know, a number of people often say, hey, the senseless violence. And, you know, what I find is, you know, people are reacting to situations for whatever reason. And in turn, we have more and more victims. And I think that families need help. I think they need counseling services. I think they need access to resources. And another major thing that we're looking at is assisting families relocating. We found that that has actually helped us as a community prevent potential homicides, where people or opposing groups have basically made promises, whether it was on social media platforms or not, to say, hey, we're coming for certain individuals. So we work with community organizations, and I'm talking outside of law enforcement, community organizations that we've been able to get resources to help relocate families and get them out of harm's way. So I think those type of resources are needed in pushing this type of legislation as well.
Yeah, if I could just jump in real
Yes,
quick,
please.
Josie, just on
Yeah, I
the
was
bill.
going to you next.
Yeah, very quickly, and thank you, Assemblymember Meeks. So
you.
currently, you have to report if you're seeking compensation in New York. That report, an application has to be submitted within a year of the incident happening. Our bill proposes that that be moved to 7 years for reasons that I think people understand. You're not always in a space to be able to confront what happened to you and to seek compensation within a year's time. So we proposed that it be 7 years. We also removed the requirement, we've been talking about this a lot tonight, that the report be made to law enforcement in order for you to get that compensation. For the reasons that we discussed, there are many obstacles and challenges with that. And I think it prevents a lot of folks from taking advantage of the compensation funds. And I think those are the two sort of big things that we're doing in this bill. It makes some other changes. It provides some other forms of evidence that you can submit to the Office of Victim Services. We changed the sort of definition of crime, not criminal procedure law, but what might qualify, and the notion that people who are involved, who may be susceptible to being accused and charged, we try to address that in this bill as well. So we think, working very closely with Common Justice, that this would put us out in front as it relates to uplifting our survivors and our victims, empowering them to get the resources that they deserve, and really increasing the numbers of individuals that deserve it.
Thank you.
Thank you so much. We're gonna just do a few more questions, and I want to go to you quickly, Gabriel. So you mentioned that Youth Alive has been involved in trying to pass legislation in California. Can you talk to us a little bit about what challenges you faced trying to pass this legislation? You know, what lessons you've learned trying to make this happen, and what you would tell people in New York and people in other states as well?
Yeah, where do I begin? So for us trying to pass this legislation in California, I think a lot of it has to do with, as Heather had mentioned, the fundamental funding structure for victim compensation. The flaws within that system really are antithetical to our goal of treating violence like a public health crisis. So if we are taking money from the perpetrators of violence, we're not understanding that they are also very likely to, at some point, either previously or afterwards, become victims of violence themselves. So we're really robbing from Peter to pay Paul with the way that we're doing this funding. But because we have been so great at doing a lot of criminal justice reforms, those funds have dried up as well. So we're seeing an insolvency with those funds. So anytime, even when elected officials agree with the intention, understand what we're trying to do, there is still a fear around the insolvency of the fund just being a complete barrier to making any kind of expansion to eligibility. So what we are trying to say, these folks who have suffered and experienced violence, have become victims and survivors, need access to these resources. Even those who agree say, well, how are we going to pay for it? So that's one of the number one barriers. Number two is, as part of our bill, we are specifically outlining that victims of police violence are eligible for victim compensation. And the amount of pushback that we've gotten, especially when people throw in hypothetical cases of, well, what if this person did this? Should they still be eligible? And ultimately, what we are trying to make sure is when somebody is harmed, regardless of who did the harm, that they are eligible for victim compensation. There are a lot of community members and elected officials who are still wrestling through that idea. So getting ahead of that messaging, and again, getting folks to understand that when somebody is impacted by violence, the best thing that we can do is use our abilities to make sure that there are not restrictions on healing resources, to make sure that those resources are flexible and accessible. And it is a waste of our time and money to try and split hairs and only designate those services and resources for a perfect victim, right? And that's the way that a lot of these systems are designed. Is they're looking for a perfect victim whose innocence is well documented. But we know that for Black and Brown communities and communities that are low resource, places like Oakland, that's not where you're going to find in a majority of the victims, right? And when we think about the ways that trauma manifests and how it impacts people, understanding that we need to reform our system to really meet people where they're at is the priority, instead of working around an outdated understanding of who is a victim and who deserves resources and who deserves to heal.
Yeah, thank you so much for that. I think that's a great point. Anthony, I want to ask you our last individual question, and then I will ask everybody one last question before we wrap up. Anthony, you mentioned something really important, which is the need for resources. I'm sorry, for the needs of interventionists, right? And the needs and resources that interventionists require that I think most people don't know about because they don't really understand the lift of the job, right? Can you talk a little bit more about that and what those resources look like beyond even just victims compensation funding, obviously, but even beyond that?
I missed the first part of your question, but
sorry. I was just saying that you had mentioned the needs of interventionists earlier, which I thought was a really important point. And I just love if you could talk a little bit more in detail about that, about the needs and resources required to really invest and do this work, and maybe some of the things that people may not know about or wouldn't have thought of.
I mean, I just started with KAVI about 6 weeks ago. So a lot of this is a learning for me as well. But some of the things that I found surprising are, oftentimes after somebody is injured, I mean, outside of like dealing with the barrier of being in the emergency room and you're not a clinician, that's often some kind of a tense space for our interventionists, because the clinicians often see them as like somebody else who's in the space. So we got to get beyond that. But once we're, working with a client or, who's been injured, after they like feel comfortable enough to talk about what their issues are, the ability to like access resources in a timely manner. Sometimes it's just, families are like confused about what happened and then like how they can, get justice or, get any number of things. We have a lot of folks. I think something that's often overlooked and was a little surprising for me is that a lot of folks who come in have immigration issues. And I mean, when you think about this ecosystem, you often don't think about that part of it. But the lack of having a legal status can be add a ton of barriers when you're trying to connect people to resources. And not just for the individual, but also for their family. So I just think that folks need to think broadly, like the same issues that affect folks in neighborhoods are the same thing that affects people who are injured and who need supports. And it's not, and it's often under-resourced and like not even considered as a need. But we actually need to like redouble all of those things, because it's usually the folks who are most marginalized, most economically disadvantaged, who like suffer the steepest consequences. And we actually want to like help them heal, but also kind of live the lives that they want to live, and help them thrive. So I think, hopefully that's a long answer to your question.
No, that's super
those
helpful.
are the types of issues that kind of are surprising sometimes when we're dealing with folks who come to the hospital.
Absolutely. Thank you so much, Anthony. So I want to give everybody on the panel a chance to close out before we turn this back to D'Angelo. But I want, I'll start with you, Jessica, and any last messages. And a lot of people are asking how to get involved with you all's work. So please provide that information and point people to any resources that you may want them to see. This is your chance. You have a lot of interested people here. And so I'd love to make sure that we get all that information out. And we can also follow up via email and make sure it's in writing as well. But just while we have everybody, we can mention it.
Sure.
I'll start with you, Jessica.
Sure. So 2 extraordinary women that I would just like to highlight who have been instrumental in terms of supporting survivors, supporting victims, their family, is Orisa Napper-Williams and also Ms. Carolyn Dixon that's on the line. When we talk about access to victim services, I think it's also important to recognize that it needs to be decentralized in a way that allows community advocates and stakeholders to be a part of stewardship in terms of healing. Ms. Carolyn and and Orisa have spent an undocumented amount of hours, not only in their own healing journey, but also the healing journey of other mothers and fathers across the city. And if we're able to empower them by allowing them to steward their own victim services that they're able to give directly to the mothers that they interface with in community, at the hospitals, at the precincts, at the morgues, just think about how powerful that could be. When we talk about co-producing public safety, we really mean allowing people that are closest to the pain to be closest to the power and making sure that they have access to those funds. While we have tremendous partners in Safe Horizon and their community programs, I also think that there should be another level and layer of that, like we see in states like Colorado, where they allow community-based partners to actually implement healing, and who better than our survivors. So definitely a huge, huge, huge wave of gratitude, love and light being sent to them for doing the impossible every day and really holding people up in times where they're experiencing the most tragedy and grief in their lives. In the spirit of co-producing public safety, plug alert, we also have a microgrant opportunity called Safe in the City Grant. The Safe in the City Grant really looks at empowering individuals to really be a part of envisioning what does safe, healthy, vibrant neighborhoods look like. We give grants from $500 to $10,000. We don't require folks to have a 501c3, just be a dope individual with great ideas that has love, caring, concern, and kinship a part of their spirit and how they want to support and really change cultural and behavioral norms around violence. So we encourage you, we meaning the team and I, who you can't see in the back, encourage you all to apply at www.nyc/peace-nyc. And I'll also put it in the chat. Because of COVID, we're accepting applications on a rolling and ongoing basis. And there's a specific set aside to trauma and healing work that takes place in communities. So I know that there are folks that want to know how to be involved. We want to be able to honor people for the dope ideas that they have, and to understand that, a part of healing is not just placing people in circles, it's actually understanding what's necessary for them to heal so that they can reach a place of thriving. And that's what we hope for. So I'll add that in the chat, and I'm just very grateful for all of you for hanging tough with us on a Monday until about 7:30 at night, honey. Okay, we understood the assignment and we gave what it was supposed to give. So thank you, everybody. Really an honor and so much gratitude to all of you. So thank you.
Thanks, Jessica. Senator Myrie, I'm going to go to you next, and then Heather, I'll go to you. you. So
Yeah, no, I will echo the sentiment and say I'm just grateful to be in this space with really great panelists, with all of you who do really incredible work in this space. I'm going to ask for three things. So the first thing is going to be, and you have the resources in the chat, I believe, send an email, tweet, post, make a phone call. Just, it can be one, it can be many. But do something to support this effort and to support this bill. I can tell you as a legislator on the other side, when we get those calls, when we get those emails, those different forms of correspondence, it makes a difference. It really, really does. So I would encourage all of you to do one of those things to help us get this across the finish line. Two, if you've already done this type of work and you're in another state, and you have lessons for us to learn about the politics of this, about the legislative hurdles you had to jump, please let us know, contact us. We're learning, we're not perfect. I believe New York is the best state, to be clear, but we don't know everything and we don't know how to get stuff done always. And so I would please encourage you to send us the tips. I think Gabe was starting to talk to us about the lessons learned. Please do that if you are in a position to do so. And lastly, this is incredibly, incredibly challenging work, and we live in an incredibly challenging time. Take care of yourself, please. You cannot help anybody. You cannot help anybody if you are not taking care of yourself. So to the extent that you can, self-care, meditation, taking a pause, all of the good stuff, whatever you like to do that, take care of yourself, because you're not going to be able to be in this fight for very long if you don't do that. And so again, thank you so much for having me. Again, I'm so grateful to be in this space, and I'm looking forward to us reconvening and celebrating when we get this bill passed and when we set the pace for the rest of the country. Thank you very much.
thank you. Heather, I'm going to go to you.
Thank you, Josie. Thank you to everyone. This has been such a rich and powerful discussion, and I've been really honored to be a part of it. I put some resources in the chat along the way. I'm putting one more now that addresses some of the issues we've discussed, but I really want to offer myself as a resource, to anyone who wants to follow up and unpack any of the existing data or some of these policy issues further. For example, I think education and awareness is going to maintain a really important part of this work. Misconceptions surrounding the difference between compensation and restitution versus the statutory requirements of VOCA compensation versus VOCA assistance. Like, this is really complicated stuff. And I think all of us being in community, continuing to learn together will go a long way. And, for so long, we've been accumulating these anecdotes, it looks different in different places. You've had this justice by geography, and yet the themes and challenges are so consistent across the country. And I think moving from anecdote to evidence and really doing data-driven and movement work across these jurisdictions can be really powerful. So thank you again.
Thank you so much. Assemblymember, I wanted to turn it to you.
All right, I just want to say thank you to the organizers, advocates, and community members that's actively engaged in this work. We have Assembly Bill 8619, Senate Bill 7573. There's also a link in the chat. Please look on. If you see that your representatives from your community are not signed on, please take a moment to reach out to them, ask them to sign on, and we'll push on our end. And we just ask that you all assist us with these efforts. So thank you all, and thanks for having us.
Thank you so much. Anthony, and then Gabriel, I'll close out with you.
I just want to briefly say thank you all for inviting us to share about KAVI and our work. And we're just thrilled to be a participant in this campaign, in this effort to provide these resources for those that need it. Thank you.
Thank you so much.
Going that, yeah, again, thank you everybody for sharing. and for the invitation to share about our work. So I did put in the chat, please follow us on Twitter or go to our webpage to learn more about how we're advocating for the state of California to treat violence like a public health crisis. Right now, we're also introducing a bill, Assembly Bill 1929, that would allow our state Medicaid program to fund violence prevention work. So this is all part of our overarching goal of responding to violence like the public health crisis that it is. Thank you.
Thank you. I'm going to turn it back over to D'Angelo now, but I just wanted to say thank you for giving me the opportunity to learn so much and talk to you all. This has been really an incredible conversation. I know there will be lots of follow-up, but I really appreciate it so much. So thank you to all of you and to Common Justice, and D'Angelo, I'll turn it to you.
Thank you, Josie. Thank you all for joining us this evening. I just want to give a thank you to our interpreters for allowing this conversation to be accessible to more people. Thank you to Josie and to all of our panelists. Again, we really need everyone's help in making this a campaign a success. So we hope that you'll use the social media toolkit that I've placed in the chat, as well as the campaign page where you can learn more about the campaign, how you can contact your legislators, and also have access to more resources. I saw a few folks ask if the webinar will be recorded and sent around. We will be sending around a link from a recording that will be posted to YouTube after the webinar is ended. So again, thank you all for your participation. Thank you all for joining us, and we look forward to having more conversation around this topic and continuing to make this campaign a success. Thank you, and have a wonderful evening.